All right, so the next part of this mobility program is going to be centered on the lower back. All right, we spoke about in the first couple of modules for the mid to upper back. The mid to upper back is really focused on restoring the backward bending and twisting motions of the spine. The lower back's anatomy is a little bit different in that most people that have lower back issues don't actually lose the ability to extend or don't lose the ability to twist because the lower back doesn't actually twist that much. But instead, what we really want to focus on are the side bending and flexion or bending or rounding elements of the spine. All right, so this next exercise we're going to go over is called the cat exercise. And this is, again, another very familiar yoga pose, but one that I think is very underutilized and not really done the best way that most people actually don't know how to do. Because what we really want to focus on is restoring the forward bending or the curvature of the lower back instead of the mid to upper back. So go ahead and go into the cat position just as you normally would, okay? Round up your back, Twee. So here, Twee is doing this forward bending curvature of her spine. And like a lot of people when they do this initially, they tend to focus a lot of their energy and effort through the mid to upper back. And that's okay, but again, a lot of people already have that motion in place, and what we really want to do is instead focus your attention effort away from the mid to upper back and actually really start to focus on creating that motion through the lower back through here, okay? Let's come back down to the beginning. All right, so can you feel the pressure of my fingers? Mm-hmm. So I want you to really try to push through the resistance of my fingers and try to create as big of a forward bending curvature through your lower back through here, all right? So you can see here it's a little bit different because she's not focusing so much on rounding her upper back. Instead, she's really focused on feeling the lower back. What do you feel the difference between doing this and the first one?
I feel the tension in my lower back.
Okay, good. So she's feeling a little bit of stretching. Do you feel anything in your stomach muscles at all?
Yes, I feel stretching in my stomach.
Okay, good. All right, come back down to the beginning. So I'm just going to re-emphasize what she just said here. So when you do this exercise properly, if you're focusing on trying to restore lower back flexion motion, you should feel a stretch in your lower back. But the second thing that she also said towards, the second part of what she said, was the engagement of her abdominal muscles here. A lot of people, when they do this exercise, they have a tendency to focus too much on their mid to upper back, and they use their shoulders to try to power through their movement. Instead, we want to really focus on using your abdominal muscles to create a forward bending curve in your lower back, like so. So go ahead, push through my fingertips. All right, and this is a little more difficult than the regular. Go ahead and round up a little bit. You can maybe up through here a little bit more. Keep going, keep going, keep going, keep going, keep going, keep going, keep going. There, hold that there and hold. Breathe. Deep breath in. Exhale and push up a little further. What do you feel there?
I feel my stomach engaging.
Good. So this is a little bit of part strengthening as well, where she's really using those muscles in her abdomen to really start to open up and stretch the stiffness that she might have in her lower back. Come back down. All right, let's just try that one more time. So go ahead and push through my fingertips. Again, really focus on getting the lower back to round. It's okay if the upper back rounds a little bit, but make sure you put your intention and your focus on your abdominal muscles and trying to create as much of a forward bending through your lower back as possible. Deep breath in. Exhale and push up towards the ceiling. Very important that if you feel any increase, if you have any hip symptoms or leg symptoms or any numbness or tingling down your leg with this exercise, go and come back down, then stop right away. There are some people that have something called flexion insensitivity, and that forward bending of the back may not be appropriate for you at the time. If you feel the stretching in your lower back, or if you feel the engagement in your abdominal muscles and you don't feel any increase in any leg pain or sciatica or any tightness down your leg, then you're good. But if you do feel pain in your leg and you don't feel that stretching sensation, or you don't feel that level of engagement in your abdominal muscles, then something needs to be assessed and needs to be looked at. But again, if you feel that stretching in your lower back, if you feel the engagement in your abs, then you're good to go. You should continue the stretch. And that's it for the cat exercise.